This video demonstrates the ultrasound methodology for the assessment of the anterior group of superior diaphragmatic or cardiophrenic lymph nodes. This assessment can be performed both using a convex array or linear array transducer. The patient lies in supine position, and the probe is positioned first in the transverse plane. The insertion of the rectus abdominis muscle to the 7th costal cartilage is shown on the right side. The expected region of interest is demarcated by the dotted line. The probe is then tilted to follow the costal arch on the right side in an oblique view in order to visualize the pericardium. The region of interest is located between the xiphoid process of the sternum, the costal chondral articulation of the 7th rib, and the pericardium as demarcated by the dotted line. The same assessment should be repeated on the contralateral side. The probe is then rotated to the longitudinal plane under the xiphoid process of the sternum for a subxiphoid view. The space between the xiphoid process, the pericardium, and the diaphragm is examined in the longitudinal plane, and the anterior lymph node group is assessed. The probe is moved laterally and medially to complete the assessment. In advanced epithelial ovarian cancer with peritoneal carcinomatosis involving the diaphragm, or large tumors with involvement of the upper abdomen, these lymph nodes are common sites of metastasis. The ultrasound methodology for the assessment of the posterior group of superior diaphragmatic or cardiophrenic lymph nodes is now shown. The probe is moved towards the midline in a longitudinal plane. The inferior vena cava and the diaphragm are visualized. The probe is then tilted to oblique view to examine the gastroesophageal junction, which is shown here. Any affected lymph nodes may be found in the region next to the esophagus, posteromedial to the inferior vena cava.